Pull back the bed linen and arrange the patient's gown to expose the ulcer and surrounding skin. Drape the patient so that only the area of the pressure ulcer is exposed.
Okay, is your arm comfortable over there?
Yeah.
Okay, good.
Cuff a biohazard bag and place it near your workspace. Apply clean gloves. Open all the sterile packages and containers of topical solution, but keep the dressings sterile.
All right, I'm going to slowly take the dressing off. If it starts to hurt you at any time, let me know.
All right.
Remove the old dressing. Before discarding it, note the amount and color of the drainage. Remove your gloves. Determine the characteristics and stage of the ulcer. If necrotic tissue obscures the base of the ulcer, making it unstageable, you'll need to debride it first. Apply gloves and assess the type of tissue in the wound bed by noting its color. Black tissue is necrotic, yellow or gray tissue is slough, and red indicates granulation tissue. Record the approximate percentage of each tissue type found in the wound bed. Note its temperature, the presence of any edema or moisture, and the condition of the skin around the ulcer. Using a wound measurement guide, measure the wound at its greatest length from top to bottom and at its greatest width from side to side. Multiply these measurements to estimate the surface area of the wound in square centimeters. To measure the depth of the ulcer, gently place a sterile cotton-tipped applicator into the deepest portion of the wound. Mark the point at which the applicator is even with the top of the wound. Then withdraw the applicator and measure from the tip of the applicator to the mark. Using another cotton-tipped applicator, gently probe the edges of the wound to determine the depth of any undermined tissue. When you've completed your evaluation, remove and dispose of your gloves. Perform hand hygiene and apply new gloves before you continue.
All right, I'm just going to tuck this pad underneath your hip here so it can catch any of that drainage.
Okay.
Okay?
Okay.
And then there's a basin.
Thoroughly clean the ulcer with normal saline or with a prescribed wound cleaning agent. Then dry the wound. If a topical enzyme agent has been prescribed, use a sterile cotton-tipped applicator to apply a small amount to necrotic tissue. Do not apply the agent to the surrounding skin. Follow the recommendations of the enzyme manufacturer in selecting a dressing for the wound. Affix the dressing securely into place. If a hydrogel agent has been prescribed, use a sterile cotton-tipped applicator or gloved finger to cover the surface of the ulcer. Then apply a secondary dressing, such as dry gauze, hydrocolloid, or transparent dressing, atop the gel to completely cover the ulcer. For a calcium alginate dressing, lightly pack the wound with alginate using a sterile cotton-tipped applicator or a gloved finger. Then apply a secondary dressing, such as dry gauze, foam, or hydrocolloid, over the alginate. Reposition the patient comfortably so that there is no pressure on the ulcer. Remove your gloves, dispose of all soiled supplies, and perform hand hygiene.